So Susanna noticed that after the birth of her first child, she started to have more gallstones. She went to the doctor and they told her that it was fairly common, but why? If we haven't met yet, my name is Bowie. I've had type 1 diabetes for over 20 years. I'm healing naturally and creating community with people who are ready to share their healing experiences so that we can build better health together. So there are 4 main points as to why gallstones are occurring. And I'll talk about at the end how pregnancy kind of creates the perfect storm for all of those options to kind of converge. So the first reason you may be having gallstones is because there's too much cholesterol in your bile. So the liver produces bile, and bile is stored in the gallbladder. Bile is made up of bile salts, cholesterol, and a small blood protein called bilirubin. The liver also creates cholesterol, and when the liver makes more cholesterol than the bile can dissolve, that cholesterol can kind of sit in the gallbladder and form these crystals which serve as the scaffolding for gallstones. So if you're eating a high-fat diet or you have chronically high cholesterol, you're at a greater risk of gallstones. The second reason you may be having gallstones is because you have too much bilirubin in your bile. So bilirubin is the yellow protein that is a component of red blood cells. And certain liver conditions like cirrhosis, liver disease, or some other condition of the biliary system, as well as blood disorders, if it's being recycled too quickly, can cause an increase in this yellow protein. Side note, that's actually what jaundice is. Jaundice is that yellow coloring of the skin that we associate with liver cirrhosis or alcoholism. That's too much bilirubin. But just like too much cholesterol kind of starts to snowball into gallstones, the same goes for bilirubin in your bile. The third reason comes down to just a downright incorrect functioning of the gallbladder. It may be not emptying completely. So the gallbladder contracts to squeeze bile out into the biliary system. If it doesn't empty fully, the leftover bile can become concentrated and form crystals. These can grow into gallstones over time. And there are diet and lifestyle conditions too that make it more likely for you to get gallstones. Anything that's going to increase your cholesterol, things like obesity, things like your diet, if you're eating a high sugar, high fat, high processed food diet, you're setting yourself up for some gallstones. And finally, for those who experience gallstones through their pregnancy or postpartum, there is a hormonal role in gallstone formation as well. And it has to do with estrogen. Estrogen actually increases the amount of cholesterol in your bile as well as slows down the emptying of your gallbladder, which is why women are more likely to develop gallstones, especially during pregnancy. But it can also happen more with hormone replacement therapy or birth control pills.